Good morning, sir.
Good morning.
Yes, sir. Thank you so much for this opportunity to interview you. Welcome to InsideAFUED, and this is a live interview with the health practitioner of the school. Yeah. So my name is Adebayo Deborah. So sir, can we know your name and what you do in the school, sir?
I'm Adekunle Ekundayo Ogunmosin. I'm the Director of Medical Services for Adeyemi Federal University of Education.
Yes, sir. Thank you so much, sir. So, starting with, what are the common health issues among students and how can they be prevented?
Okay. The commonest issues, these conditions that we see with students is things like simple infections like malaria, like upper respiratory tract infection, what you would call catarrh. Then we have things like minor injuries. Then occasionally we see people with asthma. Then we also see people with mental illness sometimes. Then we see other infections like pneumonia, like maybe even typhoid sometimes. So those are the basic things that we see. How can we prevent them? The prevention depends on the type of the condition that we are talking about. Okay. For most infections, like should I say things like pneumonia or typhoid, the basic preventive method is improved hygiene. When you do good environmental sanitation, personal hygiene, you protect yourself from many of these infections that we are talking about. Then, when it comes to injuries, one very common cause of injuries is using phone along the road. Anytime I'm going and I see students pressing their phone and walking, hey, that is an accident waiting to happen. Because many times they get carried away, they can fall into the gutter, they can trip over something and fall and injure themselves. So those are the basic things that we see commonly and how we can prevent them.
Thank you so much for your answers, sir.
You're welcome.
Yes, sir. So, what are the requirements needed for the healthcare registration?
Okay. For students, the requirement is to download the health center registration form from the portal. Some of the business centers also have copies. Once you download the hard copy, you fill in your basic information. That's the initial part of the form. Then you come to the health center, to the nursing section. They will take the blood pressure, the weight, the height, and then you go to the laboratory. They will carry out some blood and urine tests. So when you have done that, you need to go to Awushika Memorial Hospital. It's in Yaba for chest X-ray. So with the result of the chest X-ray, result of the lab, and then you will see the doctor who will do the final verification of everything. And once you have done that, he signs your form, you will take it to the records department and they will register you. It's as simple as that. The major challenge we have with registration is when students come en masse, the process is usually slower. And then the other challenge is Yaba is a little far with the price of transportation and things like that. But that is the best that we can offer for now. Because we want good quality X-ray. And the one at Awushika Hospital is a digital X-ray. And the production is very good.
So, thank you so much for your response, sir.
Yeah.
So, number 3, how do you ensure the quality of care provided by the health center staff, and what quality improvement initiatives are in place?
Okay, thank you for that very beautiful question. The, let me say, employment criteria for health center staff is whatever position you are going to occupy, you have the requisite qualification to occupy. For instance, I'm a doctor. I trained at the University of Ibadan as a doctor before I was employed. And I've been in Adeyemi since 2000. It's a fairly long time. 25 years.
Okay.
Almost 25 years. Good. So, the basic thing we ensure that whoever we are going to employ is qualified to occupy the position that is required. Okay. And after they are employed, we also do regular seminars. We discuss topics, we interact to improve our skills and knowledge so that we are up to date in whatever that we are doing. We hear a lot of stories about treatment in health center, and I smile. Okay, let me give one very interesting example. Somebody came and she said she had toothache. And the doctor prescribed amoxicillin, flagyl, and painkillers. And that is flagyl not meant for diarrhea? Okay. The truth of the matter is, the bacteria in the mouth and the intestines are the same. So the same bacteria that will cause diarrhea are similar to the ones that will cause toothache. So the treatment naturally will be similar. So many times people have preconceived ideas of the kind of treatment that they want or that they require. And so when they give them something different, then it looks like the person that is giving them the treatment doesn't know what they are doing. Interestingly, this same person took the drugs and the toothache got better. So sometimes it is not that they are not giving the appropriate treatment, it's that people expect, what people get, it depends on what they expected. Okay. But bottom line is, if anybody has any issues, I usually give my number to students during orientation. Most of the students, they don't have my number. But so many students have my number and they call me and they always respond. So I shouldn't get any problem.
Thank you so much, sir. So how do you attend to emergency patients or cases?
Okay. Now, the treatment of emergency cases depends on when the emergency comes. If they come during office hours and we are on ground, so naturally we just attend to them. If it is after office hours, the nurses are always here 24/7. Always. Anytime you get to the health center, there is always a nurse on duty. So when the nurse sees the patient, he will assess the patient and see if it's something that she can handle or he can handle on her own. If it is not, there is always a doctor on call. So the nurse will put a call to the doctor on call and the doctor would come. So several times I've even been called to come and attend to patients and I usually do. So we are very sensitive to taking care of emergencies. And then I always tell my nurses that there are two types of emergencies. There are medical emergencies, the ones that we were trained to treat, that we know that this is an emergency medically. Then there are also social emergencies. If a patient comes and there are more than 3 or 4 students following the patient, it is a social emergency. So if the patient has ordinary malaria, so to speak, and the patient is sick, it is an emergency because of the number of people that are following the patient. So you need to attend to that person quickly before the thing escalates. And we usually adhere to that.
Thank you so much, sir. That's lovely. Yes, sir. So, is there any offline or ambulance to take care of any emergency cases?
Well, my line is the hotline, and like I said, it's available to most of the students. And I usually give it out during the orientation. We have an emergency. We had an ambulance. Now we have a new ambulance. And I'm sure you have seen it outside. It's a very beautiful, well-equipped ambulance. You need to see it on your way out. In fact, maybe we'll just open it and see. You will see what it is. It's beautiful. Very up-to-date, beautiful ambulance. So whenever there are emergencies, that is what we use to take patients to other hospitals.
Yeah. That's congratulations on acquiring a very new ambulance.
Thank you.
Yes. Okay, sir. So, can outsider, who is legal staff, students, come for treatment in the health center, just like they do in other institutions?
Yes, they can. We didn't have that in the past, but since April last year, we made arrangements. So now, people who are not even related to the university at all can come up the street and attend and access care here. And we have fee collectors. They will pay for registration, they will pay for the drugs or investigations, and they will be treated. The other thing we're also doing, I'm sure some of your students might have experienced that and complained, is apart from freshmen, any other students 200 level and above that have not registered, we have started collecting money from them. If you have refused to register as a student, then you are a stranger and we will treat you as such. So we will attend to you, but you will pay for the services that you enjoy. So that's why we actually encourage students to register. For students, once you are registered, treatment is free, of course, subject to availability. So whatever is not available, you may need to go and buy. Whatever is available is free for students. But for students who have not registered, they will have to pay. We treat them like outsiders. Although even that payment is subsidized. Okay.
Thank you so much, sir. So what are the arrangements or procedures needed to make a transfer of patients from here to another hospital?
Okay, very good question. This is a primary care center, so to speak. So there is a limit to the kind of things that we can attend to. So anytime we have a patient that needs a higher level of care than what we are providing here, we usually refer them based on the kind of patients that they have. If they are staff or students, we refer them under the National Health Insurance Scheme. What that means is, if you are referred under the scheme will pay for most of the treatment that you are going to get at the hospital that we are referring you to. That is, if it's under NHIS for staff and students. But if it's not under NHIS, for those who are not registered or for outsiders who come to us, we give them a referral note to take to the other hospital, and then they will bear the cost of the treatment. And of course, if it's somebody that cannot walk on their own, we use the ambulance to convey them to wherever we are referring them.
Thank you so much, sir. So the next question, are mental health services like counseling available for patients, and how can they assist them?
Okay. Let me say counseling. Usually, let me backtrack a little. Consultation is different from counseling. Consultation means you have come, you have told me your complaints, I reach a diagnosis and I give you a prescription. That is consultation. Counseling means what you need is more than drugs or injections. You need me to put you through on a few things. So what we usually do is, for those who need short counseling, so that we can do in maybe 5-10 minutes, we do that. And most of the patients that we have need one form of counseling or the other to prevent further recurrence of their condition. So we do that. But if the person needs more prolonged counseling, we liaise with the Center for Development and Human Counseling in the university, and they help us with that. So sometimes we actually refer patients to them for counseling.
So what services does the Health Center offer to support staff and students' physical and mental health?
Okay. Apart from the corrective care, you come, we treat you. We usually organize periodic seminars especially for staff. Unfortunately, the thing is not too encouraging because the turnout is usually very low. Then periodically, we also liaise with other government and non-governmental organizations when there are programs or articles that are available for students. For instance, we collaborated with the Rollback Malaria Program sometimes last year to get free insecticide-treated nets for the community. We did a circular and we distributed that. Then just yesterday, we did cervical screening. We did a circular too. I don't know if you saw it.
Yes, we saw it.
Now, this place was flooded yesterday. That was when they bounced me from my office downstairs to come here. So we do things like that periodically. Most of them are preventive to find out people may have issues. Yesterday's program was for cervical cancer and for family planning. So we had people from Ondo West Local Government who collaborated with us to do that yesterday. So periodically we organize seminars and enlightenment programs. Then we also liaise with other organizations to provide some of these services and programs for the university community. We do that.
Thank you, sir. So are there any fees for using the health centers service?
Yes. It's only staff and students who are exempted from, registered staff and students who are under NHIS are exempted from fees. But other categories of staff, casual staff, people who are working within the university community but are not staff of like all the people in the Millennium Market, Italasa, the bank, and all those ones. We also take care of them, but they pay for the services. Then we also take care of outsiders. We take care of, let's say for instance, you are a student and you have a friend or sister or brother and you bring them, we attend to them and they pay. But it's only students and staff who are registered under NHIS that do not pay. Other people pay for the services we give them.
Okay, so thank you, sir. So what do you have to say regarding the quality of drugs or injections being administered to students and staff?
This question always amuses me. And somebody said that it's only that the drugs that we dispense in health center doesn't work. And my immediate response to that is, we admit and treat a lot of patients here, and they get better. So if the drugs are not working, how are they getting better? Abi?
Yes, sir.
And like I said, I've been here for many years, and I've been director since 2011. That's about 14 years. Agreed that we have some limitations as per funding. We cannot get all the drugs that we need. But we still operate with the National Health Insurance Scheme guideline. We provide generic drugs for patients, and we offer the best that we can under the circumstances. So if the funny thing about hospital is, if we treat 10 patients and 9 get better, the noise that the one that did not get better will make will be more than the noise that the 9 that got better will make. So we hear a lot of interesting things about health center, and I usually advise people, if you have any questions, come to me and talk to me. I think I'm a very easily approachable person. I think. And if you have issues, we can solve them out. And we always make every effort to attend to issues whenever they are present.
I would like to ask, what are the challenges faced by the health center?
Okay. The biggest challenge we are facing in the health center is the issue of manpower. Okay. There are times that on a single day we may see up to 100 or more patients in one day, and we have only 2 doctors. Like I said earlier, the nurses are always on ground. Some are morning shifts, afternoon shifts, and night shifts. But we have just about 14 nurses, which is not enough. Sometimes it's only one nurse that will be on a particular duty. The same thing in the records. In the laboratory, we have only one person that is operating the laboratory. So if for whatever reason is unable to come, that is it. So manpower is the biggest challenge that we are facing. The next one is funding. Like I said earlier, some students and staff are supposed to enjoy free medical care, subject to availability of the drugs and other things. Sometimes we don't have enough money to get all the things that we need. So patients have to go out and buy some of the things that they need. So funding is another problem. The third big problem we have is misinformation. In fact, the rumors that I've heard about health center, sometimes I'm even shocked. And several years ago, there was a major crisis in the college at that time. And the claim was that a student was brought to the health center as an emergency, and we were asking for card and refused to treat the patient. That's why the students went on rampage. That was the claim. But the reality was, the patient was actually admitted and treated. But they already had a premeditated plan to foster trouble. We were now used as the scapegoat. So when the investigation started, the student was tortured. He actually came to the health center, was admitted and treated. So we have so many fantastic stories about health centers. Sometimes, like I said, even myself, I'm shocked. And I always give people my number. If you have any issues with the health center at any time, call me. Call me. So that many of these issues we can resolve them, and many of these rumors and things, we can diffuse them before they get out of hands. Okay. The other challenge we have is with the attitude of some of our students, especially. Like I always say every year at the orientation, many of us in the health center are old enough to be parents and grandparents. Hello?
Yes, sir.
So when people come to the health center, they should give us the respect that we deserve. Like I always say, respect begets respect. There is no way you will come here and talk to me respectfully and I will respond to you rudely. Impossible. Hello. So when people come here and they start shouting, the patient that you have brought, you have not even got the patient inside and you're already shouting, what is it? And it is not how loud you shout that brings the required care. When a competent health professional sees an emergency, he doesn't need anybody to tell him or her that this is an emergency. Just a few days ago, a young lady called somebody that she was not feeling fine. Before they got to the room, she was unconscious. They brought her here, they called the 911. They attended to her, and by the second day she was fine and she went home. So we see quite a number of emergencies and we attend to them. People that are bringing emergencies should be calming down. We are not here to play, we are here to work. And whenever there is emergency, we attend to them. So misinformation is another issue. Then the other issue we have, let me say, okay, maybe it doesn't concern students, is sometimes with staff.
All these things is regarding staff and students.
Okay, good. So the other major problem we have is with staff. Staff are supposed to register under NHIS, but they have the freedom to choose where they want to be accessing care. So some of them are staff of the university, but they will register in general hospitals or some other hospitals. But when they fall sick, they will come to health center. And when we tell them, you have the choice to choose health center, you chose somewhere else, go there. You say, we are working here, you should attend to us. So what we have done now is those in that category, we treat them, but they have to pay a subsidized fee for the treatment that we give to them. So anybody who is not registered with us should go to where they register. But if they want to access care, they have to pay at least 50% of the cost of the care. And since that has helped us to solve that problem. I think those are the major ones that we are actually facing. And by the grace of God, we are handling them fairly well. And as the time is evolving, we are finding newer and better ways of handling some of these problems. I don't know if it would be relevant to give you my phone numbers now.
Yes, I was going to say it.
Okay. So my major number is 080 34 85 3580. That's my MTN number. Then I have a Glo number 081 111 070 10. So anytime there are emergencies or there are issues, feel free to call me. But if it's not an emergency, don't call me in the night. I'm a married man. So if it's not an emergency, call me during the day. But if it's an emergency, anytime is fine. Like I actually advise any new incoming ESCO of the student union. I've already seen the new student union president. I told him, whenever people give you information, call me and verify. I don't know why, but students, for whatever reasons, like to fabricate a lot of stories. And let me say this now, I just remembered. I was supposed to have said it earlier, but I remember now. There is no way anybody will insist that you should bring your card if you have a real emergency. I'm not talking of social emergency now. You bring a patient and you can see that nobody will ask you for anything. We will stabilize the patient first before we even talk about bring card or bring anything. Because as health professionals, our first priority is to save life. It's only when it's not an emergency that will be dragging issue of card. I don't know if I'm making sense.
Yes, sir.
You have come in and you are shaking. You say bring card. This is somebody that has fever and is shaking is not emergency. That one is probably social emergency. But if it's a real emergency, we stabilize the patient first before we even start talking about card. And card is very important for documentation. If you come today and you see me and I don't write anything, if you come tomorrow and you see another person, the person doesn't know what I did yesterday, so it will not be possible to continue in that same line. So there will be contradiction in treatment. So documentation in our line of business is extremely important. That's why we're always talking about card. But even if the person doesn't have card, once you are a staff or student and it's a real emergency, we will attend to the person first before we start worrying about it.
Thank you so much, sir.
Yeah.
Yes. So what advice do you have for maintaining a healthy lifestyle while balancing academic and work stress?
Okay. A healthy lifestyle is a combination of many things. Okay. We are talking of personal hygiene, environmental sanitation. We are talking of exercise. We are talking of rest and relaxation. We are talking of good diet, healthy diet. We are talking of stress management. It's a whole lot of things put together. It's a lifestyle. And so each of us must fashion out what works for us. And there is no one thing that you can do to maintain good health. It has to be a combination of many things. Some of you may have met me during my morning workouts. I highly recommend exercise. Exercise is good for so many things. So just like I recommend it, I also do it. Abi? Yes. Because just like it is good for my patient, it's also good for me. Then one other very important thing that many people take for granted is sleep. As an adult, you need at least 6 to 8 hours of sleep every day. But social media will not allow so many students to sleep. Because chatting is cheaper at night, Abi? Yes. It's cheaper, the data is cheaper.
Yes, sir.
Cheap data at night can ruin your health. You are still very young, so you may not even notice the effects. And that is the problem with many unhealthy behavior that people have. The effects take many, many years to manifest. So even when the thing is manifesting, you don't even remember like what you did years ago or what you have been doing over the years that is possible. So exercise very important. Rest and relaxation. Eating well. In this Jagaban era, God will help us. But at least we should try to have a good diet. I think if we did that, we would be healthier. And then hopefully we have fewer patients in the center. Abi?
Yes. Thank you for your response, sir.
Yeah.
So what is the most important health advice you will give to students and staff?
Okay. The bottom line is prevention is better, cheaper, more convenient than cure. So it is better to stay healthy than to fall sick and need to be treated. So healthy lifestyle is extremely important. For young people, maintain a healthy lifestyle is relatively easy. It's as you are getting older that you need to be stricter with yourself. So if you live a healthy lifestyle, you're able to prevent diseases, and then your need to come to the health center will be reduced. So, and it will also relieve our own stress too. Thank you.
Thank you, sir.
Yeah.
So we've heard a lot from what he said, and I believe we gained one or two things. So it's actually best we make our heads paramount. So thank you so much. We remain InsideAFUED. Thank you.
I just want to, sorry, these are people from InsideAFUED. They came to interview me. And one of the questions they asked is that they have an only relationship with
Like, yes, I'm not
Okay, if I let me use this as a very good example, snap it. Then take it to the pharmacy and just ask the price. Don't let me say more than that. No, TS, you can find out the price of TS.
Find the price of this.
Okay, this is another one. So don't take our word for it. Just go, just ask them, pay all these jobs that you have seen. They should just tell you the prices. This is the dispense. Mrs. Adekunle, ever open stop. Ṣé kìtì bá wà lọ́wọ́ yìí? Ó yá ẹ ṣí. Mostly drips here and syringes. Okay, this is our mixture. In fact, like I always tell people, in health center, we can guarantee that we will give you malaria treatment. All these ones are malaria drugs. We make sure that if you come home, we will treat you for malaria. That's the treat you.
As it is, this is 14K. So you can calculate, you can really calculate.
This is our lab. This is our analyzer. Any sample to analyze?
Thank you, sir.
So you can see this one as you are bringing it down, the legs will come down.
Damn.
Very easily.
Damn.
Yeah, now they pay Obeni.
Yes.
And when you want to put it back, then we have a spare carrier here. Something similar, but this one is hand carried.
Okay.
So you can turn
Yona ka.
University one now.
No.
Maybe your money won't out. But since it is brand new, I think it's 2024 model.
Wow.
So
Wow. 2024.
it does the ordinary car.
Damn. No, still like it's still banded
Okay,
with
so-
something.
Good. Good. That is the window. I need this one to carry another. Okay, let's